Dr. Ravi, welcome. Okay, so kita juga ada hari ini di kita punya Zoom, Dr. Ravi, medical doctor. So kalau anda ada apa-apa soalan berkenaan penyakit atau ubat yang anda ambil suplemen, jika anda ada nak tanya apa-apa, anda boleh juga tanya soalan kepada Dr. Ravi ya. Hari ini beliau.
Sheila.
Yes, doctor.
Good evening.
Good
Just
evening.
now the lady asked about this husband's problem about the milk, right? So actually, lactose intolerance is quite common in the other side, but that is all related to dairy products. But this is purely being a soy protein. Okay. So it's maybe it comes like a milk when it is made into a solution. So that psychologically affects the person. I think maybe you have to convince him clearly that it is not the milk that you get from the dairy side. It is actually a soy-based product.
Yes,
that's
thank you,
very
doctor.
Important.
Yes, yes. Thank you, doctor. Thank you, doctor.
Thank you.
Area ni faham area ni apa yang doktor jawab? Ramai orang ada masalah bila nak minum macam yang tepung-tepung tu dia ingat itu adalah milk product. Ya. Yeah? Jadi psychologically dia sudah ada mindset kalau minum ni tak sesuai untuk saya. Jadi area ni kena bagi tahu dia lah, ini kita punya bukan susu, dia adalah high quality soy protein. Made of wheat, pea dengan kita punya good 9 essential amino acid ada dalam tu. Semua ni Irani boleh share. Thanks doctor for the enlightenment. Okay, any soalan lain boleh tanya? Jangan malu, jangan segan. Dr. Ravi pun seorang ABO juga dalam tim kita. So you can ask question. He's a very well-known doctor dengan pengalaman yang begitu lama. Beliau pasti boleh jawab soalan anda jika ada apa-apa nak tanya. Yes. Prasanna, okay, if there is any question in the chat box, you can read for me, Prasanna. I cannot see here.
Belum lagi ada soalan.
Belum. Doctor, in your experience, maybe you can share. Okay, there is a question. Hello, doctor. What is the?
I didn't see the full question.
Hello, doctor. What is the ideal protein intake level for adults and kids?
Well, there is no specific thing, how to say ideal levels. Basically, our daily food everywhere in the world is made up of carbohydrates, more of carbohydrates. So we have to, whatever we take in our combination of food, there will be enough of carbohydrates. So it is ideal to consciously replace this food with protein diets. So no need to worry about getting excess protein into the body. So you can take protein enough, as much as you like.
Okay. Thank you, doctor. Thank you, Dr. Turga. Okay. Okay. Area ni nak tambah apa tu? Boleh ke saya nak tambah sikit protein dalam minuman anak? Anak ada umur 7, 3 dan 1 tahun. Ya. Tadi doktor ada jawab. Yes. Sebenarnya semua makanan
it is okay. It is okay. Can.
Boleh dia ni, boleh.
Recommended.
Recommended, disyorkan. Okay, very good.
So touching about the gut health just now, I think in a layman's term, it's called leaky gut syndrome.
Yes,
right?
yes.
In the medical term, it is called irritable bowel syndrome. But the irritable bowel syndrome has no role for any surgical correction. That means abdominal surgical correction, as well as medical therapy is not very well recommended. If you see nowadays and you Google search in many of the medias, they are more talking about supplements and health related products that works. So, and this irritable bowel syndrome is mainly they call the gut-brain axis syndrome. That means this gut is related to brain. So what does brain tell the gut? Is full of stress. So again, stress is the cause for every other known disease. So it is a gut-brain axis syndrome. The first thing that comes as the cause when I actually went into the details. Of course, there are genetic issues also that can cause irritable bowel syndrome. And a lot of psychological causes also. You may find it very unrelated. Why a psychological problem, stress and everything can lead to, but that's how it is proven right now.
Yeah.
And the food that we take also cause problem, because the food that we take most of the time is contain all the bad bacteria that are accumulating and destroying damaging our mucosal lining and the things. So putting all the good bacteria, like in the case of is what we have. I mean, and most supplement companies which have is the if you see bifidobacterium, lactobacillus, acidophilus, 2 varieties, and bifidobacterium. It's all in the packet, in the box, in our botanical beverage. All these are in billions. So when you take them, it's actually reversing the thing. So you're reversing the 85-15 to the other side. Now it's full of only 15% or less good bacteria. But by taking this, you are increasing it to 85%.
Correct,
So
doctor.
that is very important to take the probiotic. And I found it quite easy. All I had to do is take, I think you can mix it in food and also juice, but I think it is not, just take if okay to take some cold water because it will mix well, put in your shaker, the 2 scoops, and this one packet, shake it well and drink. It is, you don't need any sugar actually. It is very tasty.
Correct.
It's filling.
Correct.
The only thing I have to wash the utensils immediately, otherwise it smells.
Yes.
That one I clarified with Diamond Muthu 2 days back.
Yes, doctor. You're right.
It's convenient and it's faster also.
Correct, doctor. Okay, there is
we can do it ourselves.
Yeah, there is one more question, doctor. What do you recommend for people having breast cancer and they are taking chemo tablet? Is there any supplements for breast cancer and the patient is now taking chemo tablet?
Okay, this is something out of the wellness area. They already fall into the cancer category.
Yeah.
So there are specific treatments that are going chemotherapy, then they go for radiotherapy and everything. So chemotherapy is one of the drugs that they use. And of course, any drugs, they also kill the normal cells and everything. So they need some supplements. They can go with this gut protein system, which is going to help. And plus the other supplements that we have in our daily or the double X, BioC, and all those supplements are definitely going to help in the recommended dose that we all practice. Can be taken.
Okay. Jadi apa yang
vitamin C will help.
More vitamin C. Okay.
More vitamin C.
Yeah. Okay. So Yoga, Yoganes, you got the answer, Yoganes? Okay. So macam tadi doktor bagi tahu jawapan kepada soalan tadi yang IBS tu. So gut brain axis syndrome. Jadi banyak perkara ini berlaku disebabkan oleh makanan-makanan yang kita makan pun sudah ada banyak bakteria. Itu satu sebab. Dan juga tadi doktor bagi tahu psychological effect pun ada kaitan dengan kita punya usus, ya. Jadi psychologically orang stres ataupun mereka runsing, semua ini boleh beri efek kepada usus, dan usus yang beri signal kepada anda punya otak. Jadi dia ada banyak connection. Ya, seperti mana doktor juga bagi tahu tadi, kita punya probiotik senang, mudah untuk diambil. Boleh juga kita campurkan dalam makanan, boleh juga minum macam tu, ataupun anda boleh campur dalam shaker, kocak, minum saja. Lepas minum, terus anda kena cuci anda punya shaker. Kalau anda biar, dia boleh bau busuk. Ya, immediately clean it. Yeah, that's what Mr. Mutu share dengan doktor. Yang itu yang kami pun buat. Setiap kali lepas minum, terus cuci. Jangan tunggu untuk cuci kemudian lah, nanti dia akan berbau sangat kuat. Okay, so there is also another question, doctor.
One more
Let
thing
me
is actually
yes,
I know gut protein is the 3, but need to take our CalMac D also, because vitamin D helps to improve the gut microbiome system. So there.
Oh, thank you, doctor.
Anyway, so and I think the CalMac D is not too expensive. It's quite reasonable price from those days itself.
Yes. Okay.
So vitamin D is essential.
All right. Thank you, doctor. Can add on with the vitamin D.
I saw one question asking whether diabetics can take.
Yes,
much
doctor.
they can take. Very much they can take. Not the issue.
Can take.
Because we are talking about protein and removing the part of the carbohydrates and everything.
Yes.
So
correct. Okay, I can see there is one more question, doctor. What could be the reason for high creatinine level in blood in children? Is protein could be one of the reason? Question by Durga Manikam. High creatinine level in the blood for children. What is
not necessarily protein? Actually, it could be some other reasons that they have to follow up with the pediatrician and see the blood test and everything. Why the creatinine is high? That's very important. The kidney functions have to be assessed before we know that there is a protein malnutrition.
Okay. All right. Okay. So in your experience, doctor, can you share about like just now you were mentioning about IBS? What are the diseases related to gut that you commonly see in your patients? Do patients come with
infective colitis? Right?
Infective colitis. Okay.
And then that in progression it can lead to cancer in the lower part of the bowels. Okay. These are all advanced things. The leaky gut syndrome can lead to a lot of chronic diseases in the bowel system.
Okay.
So
what do you think the main cause? What do you think, doctor, that leads to this leaky gut syndrome and all that? Now we are giving the solution. Actually, what actually is the cause?
The diet.
The diet,
The diet.
Okay.
Diet that we are taking. The so-called diet that we are taking is not healthy actually. It's
unhealthy diet.
Fermented food and all those things is not very good.
Okay.
Especially this carbohydrate-rich diets. If you take a lot of doses, actually, especially Indians now, other races also taking. It actually gives you a bad burp and this thing. Sometimes some people get tendency to nauseated and vomiting after food. And they tend to cough it out also. So all those are fermented stuff. So these are the things that never give any supply of protein to our body. Just gives you the energy, burning of the energy. But then what happens is the balance is actually transmitted into deposits of fat. So that's where people don't get it. The important thing is it causes these foods cause a lot of bloatedness, flatulence. Not only in the upper gut symptoms, like burping, down also. So it's a very inconvenient thing. In the type of IBS which has more prominence is actually the diarrhea prone. Constipation is less. And mixed variety is also less. Most of the time, it is actually related to diarrhea. And very difficult to give anti-diarrheal medicines all the time.
Okay.
Later, they'll have problem with constipation again.
Yes.
Keep alternating.
Okay, doctor. So just let me share a bit in bahasa, doktor. Okay, so thank you very much. So terima kasih. Tadi apa yang doktor bagi tahu adalah macam yang masalah usus ni dia sebenarnya ada mixed cases yang doktor tengok. Ada yang macam cherry beret, ada juga yang macam sembelit. Dan kebanyakan daripada cases ni adalah macam dia bukan sembelit tapi dia diarrhea. Jadi semua perkara-perkara ini disebabkan oleh makanan yang kita makan. Makanan macam yang fermented food, macam dia boleh menyebabkan ketidakselesaan di perut, dan juga kadang-kadang kita boleh kentut ataupun kita boleh sendawa, di mana semua ini adalah tidak selesa untuk kita. Jadi kebanyakan masalah usus disebabkan oleh diet, macam makanan-makanan yang goreng, kita makan lewat malam, makanan-makanan yang unhealthy dengan banyak garam, dengan banyak gas, banyak gula, semua ini dia ada connection dengan kita punya usus. Jadi usus kita perlu ada 85% good bacteria. Bad bacteria harus ada 15% sahaja. Tapi orang yang ada masalah usus ni sudah terbalik. 15% bakteria bagus dan 85% bakteria jahat. Itu yang menyebabkan masalah usus. Jadi gut protein boleh bantu selesaikan masalah-masalah ini. Alright, okay. Ada lagi apa-apa soalan?
There's one question here.
Okay.
By Puspita Sari, to continue the question about chemotherapy patients. So my friend frequently taking antibiotics because of that. If he take our probiotics, apakah antibioticsnya akan mematikan the probiotic, or it will help to replace? How much he should take the probiotic? Thank you.
Sorry, if I may. These two are two different things. It will not disturb either or. Antibiotics have been given for a purpose by the doctor. When there is chemotherapy going on, they suspect some other infection source in any other part of the body. And antibiotics, as you all know, it is not taken or given for a longer period. But what we are taking, these probiotic supplements, are pretty much, if one wishes, it's lifelong. So there is no worry to take both. Can be taken. Because the antibiotics is just going to be short term.
Okay, so they can continue with the probiotic, doctor.
Yes, probiotics is whatever supplements that we are taking, the natural supplements, no need to worry about discontinuing it when there is some other medications going on. Unless it is in very specifically very high doses we are taking, then we need to consult the doctor. What we are taking is optimal doses, optimal health. So I don't think there is any.
Okay, thank you, doktor. Okay, jadi apa yang doktor jawab adalah untuk soalan Puspita Sari tadi, dia tanya kawan beliau yang ada kanser diberi antibiotik. Jadi tadi kita sebut bila ambil antibiotik, probiotik boleh mati, boleh hilang. Jadi bagaimanakah haruskah probiotik diambil, berapa banyak perlu diambil? Jadi jawapan daripada doktor kata kes-kes yang kanser macam ni, doktor akan tahu apa antibiotik yang perlu diberi, yang itu akan diberi untuk satu masa yang singkat saja. Not for a longer period, for a short period. Jadi itu khusus diberi untuk patient tu disebabkan kanser yang beliau ada. Tetapi probiotik kita boleh terus ambil, continuously boleh ambil sebab untuk optimal health we have to take this nutrition ikut dia punya recommendation. Alright, okay, thank you. Any other question? One last question. Prasanna, any question, Prasanna?
No. For now, ada satu.
Got that, Prasanna?
Yeah, one question. Kalau seseorang sentiasa ambil protein, lepas buat blood test dan urine test, dalam result doktor bagi tahu protein sudah berlebihan, apakah tindakan boleh ke patient tu stop mengambil protein?
This is more of a question on the medical. That is okay, but if there is protein leak, then there is other proteinuria, they say. So protein gets digested, assimilated, and it breaks down into amino acids and it's passed out. So if the protein is passing out in the urine, that means the protein is not broken down. So there is some other medical condition inside that. So that they have to refer back to the primary doctor.
Okay, jadi apa yang doktor kata?
So if there is a problem.
If there is a problem, then only the protein will leak. It's leaking because it is not broken down. So there may be some other causes. Is it, doctor?
Yes.
Okay.
Dr. Ravi, doctor. If this protein leakage happens, if the kidney is not functioning well, right? That means
yes,
there is function.
That is the actual thing. Yes.
So the kidney is not functioning well.
They need to see a physician or a nephrologist to get better assessment.
But
that is what
taking the protein, because of that, if we stop taking the protein, then that person lack of protein also, right?
Yeah. But what I would say is, if they have such a situation, they could consult with their doctor first and then tell them that they are taking. So go with the balanced view at that point of time. Because when they have a medical condition, it has to be treated as case-to-case basis. If they don't have that particular issue of that thing, then it's okay. We can freely recommend them.
Thank you so much. Thank you.
Okay, thank you.
There are a lot of protein-related nephropathies. They call nephropathy is actually disease to the kidneys, protein-related.
Okay.
So those are the conditions where they have to consult the doctor first. Doctor also must be the physician or related to nephrologist, kidney specialist.
Nephrologist or kidney specialist, huh?
Kidney specialist.
All right. Okay.
Not the urologist. The urologist is a surgeon doing the operations along the kidney. This is the medical part. Two different things.
All right. Okay. All right. Okay, and I think today a lot of questions and a lot of doubts we have cleared. Jadi saya nak ucap terima kasih kepada doktor jadi bagi pihak tim kita. So walaupun doktor sangat sibuk, beliau memang sangat sibuk tapi hari ini dia luangkan masa dia untuk join kita punya sesi ini dan menjawab soalan-soalan. Kita ucapkan terima kasih kepada doktor, anda doktor. Okey, jadi dengan sesi soal jawab ni, jadi kita tamatkan session ni dan kita akan jumpa selepas 2 minggu lagi dengan topik-topik menarik yang lain. So with that, signing off, wellness coach Shela, and thank you again, Dr. Ravi.
Thank you very much. I would like to just also add in one more thing. Besides the diet that we discussed, I think everybody gets into some form of exercises and some kind of sports that they prefer. It can be volleyball, netball, golf, badminton, cycling, whatever. Pick up 2 sports, do it regularly, weekly, and then do the exercises on your own. Go for yoga classes, meditate. Meditation actually increases your brain's theta waves. that is the time only your theta waves are activated, not in other times. And theta waves are very powerful brain energies that can program our minds to get what we want in life, and we can also program to remove what we don't want in life. So all these are holistic approach actually.
Yes, doctor. Yes, doctor. Okay, thank you so much.
Thanks for inviting me, Diamond Muthu and Sheila, to
okay, thank you, doctor. Thank you so much.
Whatever opinions that I had, whatever knowledge I had.
Thank you so much. Thank you, doctor. Thank you.
Thanks, doctor. Thank you. Okay, thank you. Selamat malam semua. Jumpa anda di sesi yang akan datang. Okay, good night.